record, so just know that going forward. And I just got my little notification that we're gonna record, so et voila. We've begun our recording. My name is Clarissa Taylor Jackson. I am with the National Alliance on Mental Illness, the Metropolitan Baltimore chapter. I am very proud to help present the second webinar in this series, It Starts With Us, Building Dynamic Congregational Mental Health Teams. And this is the second webinar in our series for Mental Health Awareness Month. NAMI Metro, we have several activities happening in May this month, so you do want to check out our website. Go to namibaltimore.org to find out what we're doing this month. You can follow us on Twitter, follow us on Facebook, just NAMI Baltimore, search out NAMI Baltimore and you'll find us, and you can follow us and keep up on what we're doing this month and every month. As it relates to things that you can be engaged with. But today, I am so very happy that you have joined us. We are, as we shared last week, this is our sixth annual iteration of the Mental Health Education Conference for Faith Leaders. We are very passionate about providing good information, relevant information to those who are in charge of spiritual life for thousands of Metro Baltimore area people. And as such, we want to make sure that we try to bring you the best people, the best sources of information, because you guys are on the front lines at the end of the day. We consider you to be first responders in your own right, because as we know, many congregants, parishioners, will first go to their faith leader before sometimes reaching out to medical professionals or other emergency professionals for help. And so while we recognize that not all faith leaders are mental health professionals, we do want to make sure that you have the very best resources at your fingertips so that you can feel prepared to be able to stand in the gap and support your congregants in their time of need, and also to support your staff and train your staff so that your front office staff, as I like to say, the front office can be as trained as you to be able to help in a crisis, especially a mental health crisis. And so today, the second webinar in our series will be brought to you by Reverend Dominic A. Smith. I do want to make a note about this webinar before we begin. First, let me just go back and give you a few housekeeping notes. Feel free to put your questions about the presentation. Feel free to put them in the Q&A. Recognize that sometimes your questions may be answered throughout the presentation, but go ahead and put them in there anyway so that we can record them. We have NAMI staff on standby, Jamie and Nova on standby to help field any questions that I may miss or that aren't answered in the presentation itself. Also, if you just want to generally make a comment or ask a question of NAMI Metro staff, Jamie and Nova will be helping to manage our chat as well. And so if you have just a general question, you're welcome to put that in the general chat, but specific to the presentation, you really want to put it in the Q&A so that we can track that and follow along. Now a note about the presentation that you will experience today. Reverend Dominic A. Smith was all ready to go for our presentation today. Unfortunately, he experienced a loss in his family and he could not be with us today. However, he was gracious enough to record his presentation and tried to be as thorough as possible in his presentation to answer any questions that he anticipated in his presentation. So in a moment, I will play the recording of his presentation, and I will go ahead and spare you secondhand embarrassment. I kind of recorded it as if it was kind of live. I was bummed out that it wasn't going to be live, so I tried to add a little flavor to it, but just kind of looks weird. But anyway, just go with me. I appreciate you and your energy. It's really good information that Reverend Smith is sharing. At the end of his presentation, I will share his contact information so that if you have a question that NAMI Metro, that myself or other staff members cannot answer, we will make sure that Dominic A. Smith gets that information. Well, you have his contact information, and that I'll also share those questions with him so that you guys can connect offline and you will be able to get those questions answered or answers to those questions and even begin to ask further questions beyond what he's sharing in an effort to help you in any way as you are building your own mental health team. Okay, and so with that, I will turn it over to, well, I'll just start the presentation. So once again, I see that folks are still joining us. So thank you so very much for joining us this morning. And in a moment, the next voice you will, well, you'll hear me, and then you will hear Reverend Smith. So thank you so much for your diligence and standby. And for the next webinar in our series, I am delighted to introduce Reverend Dominic A. Smith, who will bring words of encouragement and really good information today. So let me read his bio. Reverend Dominic A. Smith pastors the Ezekiel Church and Ministries and serves as the first vice president of the United Baptist Missionary Convention and Auxiliaries of the state of Maryland, Inc. As a community pastoral outreach coordinator, he delivers pastoral care and health education to a diverse inpatient and outpatient community-based population of many faiths. He earned his Master of Divinity from Duke University Divinity School, studied at Lancaster Theological Seminary, and attained his Bachelor of Science degree in Communication Studies from Morgan State University. Currently, he is working toward a Doctor of Ministry with a focus on faith and health. And with that, I will turn it over to Reverend Dominic A. Smith. Reverend Smith.
Good afternoon, and thank you, Clarissa Jackson, for that introduction and for this opportunity. Thank you to everyone who tuned in today. Last week, we heard from Bishop C. Guy Robinson, who talked about critical collaborations, faith, and mental health professionals as partners in community care. Hopefully, my goal is to build upon that conversation as we discuss mental health matters, building effective health ministries. Next slide, please. U.S. healthcare is a sick care system. This is the care you can expect to receive when you become ill or have an emergency. Social determinants of health are conditions and environments in which people are born, live, work, play, learn, worship, and age affects a wide range of health, functioning, and quality of life outcomes and risks. Let's look to health ministry. Health ministry is a ministry that allows one to engage others within the faith community, local government, hospitals, public health, clinics, etc. And it offers partners and partnerships in faith and health are different and unique because the people work together for members of the faith community and the community at large. We are familiar with a variety of faith traditions, Christianity, Buddhism, Baha'i, Unitarian Universalism, Judaism, Islam, etc. And so all of these denominations or faith traditions are engaged or can be engaged in health ministries. Next slide, please. Let's talk about the history of health ministry. Ancient rituals, as we know them, or religious ceremonies, consist of a sequence of actions and words or rites that are performed or spoken as a part of a worship service. For example, there's a bar or bat mitzvah, there's first communion, sweet 16, and sunrise ceremonies. Then when we talk about biblical healings, I'm reminded of a text in the Christian Bible in Mark 8:22, where it tells of how Jesus heals the blind man in Bethsaida by first spitting on his eyes and then touching him. This account is similar in the book of John, the 9th chapter, when Jesus spits on the ground. He makes mud and he takes that mud and places on the man's eye. And then the man, his vision is brought back. Some early Christian practices that we still engage in today: baptism, Eucharist, prayer, confession, confirmation, marital rites, burial rites, and religious education. Then we talk about religious nursing order or deaconess hospital, and that deals with a religious nursing order that first honored the various religious practices of people in their healthcare system. And then it also helped to develop what we call, or they're labeled as, deaconess hospitals. And these hospitals are around the world. Some are in Edinburgh, some are here in the United States, in Indiana, Massachusetts, New York, and the state of Washington. Contemporary health ministry is when we begin to move forward and have formalized hospitals and formalized clinics and wanted to be up to date in our health offerings. And then there's the faith community health that talks about a community surrounding the faith community and the faith community working in concert to offer effective and meaningful health ministry. May we go to the next slide, please. I wish to talk about language of health and salvation. The language of health and salvation. The language of health, as we see here on the screen, it deals with some of these titles or names: disease prevention, exercise, lifestyle, health professionals, safety, wellness, illness, community and public health, and health screening. And the language of salvation deals with journey, healing tradition, support, spirituality, faith community, God, caring community, sin, and reflection. And when these languages work in concert and these actions work in concert, we are working towards wholeness of being one, understanding the health and salvation, that they can work in concert together. Let me go to the next slide and let's talk about components and roles in health ministry. Organized health ministry addresses the health of both community and faith community. Health ministry, it ministers to or meet the needs holistically, and it finds common or even ground where we can work with social justice, hospitality, and work with all the generations or ages present in our faith communities, in our communities at large. Health ministries thrive in local congregations and communities when the clergy and or the leader of the house, rather that be an imam, rabbi, pastor, or priest, support the health ministry. And health ministry includes a variety of speakers and support groups and advocacy efforts from others who can bring health education and teaching to the health ministry. Next slide. Health ministers play a very big role in a health ministry. Health ministers comes from various backgrounds or have various backgrounds. They are barbers and they are lawyers. Some are stay-at-home parents. Some are accountants, some are builders, some are landscapers, and some work in an office setting. Health ministers help you to navigate your health care, and they help with being outreach workers, health ambassadors, and they promote good health as well. Next slide. Now, the American Nurses Association and Health Ministries Association approved a new registered nurse certification program for faith community nurses. Many of us are familiar with the traditional nurses in the congregation that may or may not be a nurse. And then some of us are familiar with parish nursing, and most of them had LPN or RN certification. This program that's been developed, or curriculum, I should say, teaches the faith community nurses how to interact and develop effective health ministries to engage within the faith community and the surrounding community. It also teaches how to do asset mapping And what that does is help you to identify health information and health centers that are surrounding the faith community. Some of the key roles of faith community nurses may include health counseling, health education, offering referrals, health ministry team coordination, and volunteer coordination. Next slide, please. Population-based care builds connections with local community through hospital-based faith community health network. Now, I do know in our region, there are one or two hospitals, or a few hospitals, I should say, that have faith and health segments, either through their pastoral care or through their population health department, that reaches out to faith communities to help these faith communities enhance their health ministries. For example, some hospitals or hospital systems offer classes on hypertension and how to reduce it specifically for the faith community. Some offer classes on becoming a babysitter, getting that certification. Some offer classes on CPR training, and some develop classes for first responders in congregations, such as the ushers or the ambassadors or the security team. So that's a network that's developed, but like I said, between hospitals or hospital systems and the local faith communities. They work together to provide a continuity of care. When working with a local hospital or hospital system, it enables you to get the latest information that comes out with healthcare and to be provided with right information. May we go to the next slide. Community-based faith community health network is a group of individuals that represent faith communities within a particular region who meet regularly to discuss successes and challenges, provide support for one another. In other words, it is a group of people who work in concert within their various faith communities who are from the same region, who work to exchange ideas, to support one another, to encourage. Some of the other roles of health ministers, they help to organize health fairs for congregations or communities. And being a part of a regional health networks helps you to learn, gain ideas, share, and to expand your network and possibly build upon your own programming. Why don't we talk about some guiding questions to ask when developing a health ministry? Can we go to the next slide? Some guiding questions when developing a health ministry. For example, what are the goals and the purpose of the health ministry? What's the focus? What are our limitations? What are the lines of accountability? And how will the ministry be implemented? This is very important. What is the congregation's theology about health ministry? And what are the theological concepts or mission that motivate people to be involved in a health ministry? How will professional ethics, legal requirements be addressed and monitored? Professional ethics and legal requirements, how will they be monitored and maintained? Next slide, please. We have to determine the model you will use. You have to do a survey to determine the needs of the congregation that the health ministry can meet. Who will evaluate the program? And how will the program be evaluated? And how often will the program be evaluated? What are the marketing strategies? What are the strategy to achieve the implementation of the health ministry? Have we set a target date? And what are our goals we plan to accomplish? Who will lead the personnel? How will they be selected? And what qualifications are required? And what training will be given or offered? So we have to ask this question. What's involved in developing a liaison relationship with community resources? How will we make connections within the community? Will we attend trainings? Will we attend community forums? Will we be connected to our healthcare, to the clinics that are in the area? Then we have to talk about the legal piece of having a health ministry. What concerns must be addressed regarding liability exposure? So you need to have a conversation with the leaders of the congregation who deal with the insurances and talk about rider and such things as that. Then there have to be determined what the role of the health minister or the leader will be who organizes. What is the role of lay volunteers working within the health ministry? How far can they go? What are their limitations? What are their boundaries? And how far can they expand? This is something that we always have to talk about when we deal with ministry. What's the budget? How will the program be funded? How much funding will be needed? And where would the funding come from? Who will serve as a professional support network for the health minister? Where will the health minister go to remain current, to get current information? Are there certain websites that the health minister will read off? Are there certain classes and trainings and workshops or continuing education credits that the health leader will engage? Next slide, please. How will clearly stated, measurable evaluation standards and practices be developed? So in other words, what are the standards and the practices? And how often will an evaluation be completed? What are the possibilities for ongoing regular education for the health minister and for the lay volunteers? This is something that can be offered free from the various networks and connections, and it is something that may cost money for certifications. How will HIPAA, or how will rather confidentiality concerns be addressed? If you have people's information within the congregation, they must be secured, and people must feel confident that this information is not being shared without their permission. And what will guide the health minister and or lay volunteers when responding to an emergency? Will there be a health ministry suite? Will there be an area where people can move to? Have we developed plans for evacuation if an emergency comes to the congregation? We must determine who will call the 911, the emergency, if an emergency happens in the congregation. These are just a few questions to help you to think about when you're considering developing a healthcare ministry. Let's go to the next slide. And one of the things I want to talk about is the structure for a health ministry. The structure for a health ministry. You know, it's always important to have orientation, and that the health ministry should not be an ad hoc committee. It should be a regular committee within the church. There needs to be leadership in that committee or that ministry, a chairperson and vice chair and secretary and treasurer and so forth. They need to meet regularly to develop the plan, to review the plan, and to implement and evaluate the programs that they are sharing with the congregation. Membership to the health committee can be any church member, any congregational member who is interested in promoting health within the congregation in a wider community. Include health professionals as well as non-health professionals. and others, because I find that it is helpful to include people who work in the health field or retired from the health field, as well as those who have not. It is always good to have the laity working together because they can bring to the table various questions that may need to be addressed that everybody in the health field may already know. And so the purpose of the health ministry is to be a blessing and to provide excellent information to all. The health ministry leaders and the health committee should work closely together. Now, the pastor, the imam, the priest, the rabbi, the leader of each congregation or faith community is an ex officio member and should be invited to attend all meetings when possible. And if they're not able to attend, they can send their representative, but a detailed report should always be given to the leader of the faith community. Because when the leader of the faith community supports the health ministry will flourish and be able to help many people. Next page. Some of the duties and responsibilities include to develop or use an existing tool to perform a health needs assessment of your faith community. You have to learn what the needs of the community are. Don't make any assumptions that people have end of life issues resolved. They have documents. Don't assume anything. Present the information. But it's important to do a health needs assessment to learn what the needs of the faith community are. Plan and implement an introduction and or commissioning service for the leaders and members of the faith community. This sets the health ministry. This sets the health ministry apart, meaning it means it is sanctioned by God or the supreme being. It is sanctioned by the faith leader, and it is sanctioned by the members of the faith community that says, we support you in this health ministry. Of course, you want to develop mission statement, goals, and job descriptions for both the health ministry leaders and for the volunteers. Next slide, please. After completing the health needs assessment, you want to plan and implement appropriate programs and activities that address or meet the needs. Of course, you want to promote health through frequent, for example, health hints. Perhaps you can provide something in the bulletin weekly, or perhaps there can be an electronic announcement that comes across, articles in the newsletter, or bulletin board displays. But you want to offer something about health on a weekly basis, if possible. And then you want to join a faith community health network to receive ongoing educational and resources and develop relationship with other health ministries. I think I spoke earlier about the components of health and what we talked about, a regional health network. This is an example of such group that you should join, that you can work together. Next slide, please. We should raise awareness of your health ministry and increase support among the members of the faith community. In other words, do campaigns. Let people know that the health ministry is around. Be a part of other activities and ministries in the church. Have a method in place that provides for smooth transition of leadership. When it's time for leadership to transition, have that in place where information is shared, ideas are shared. Each leader that comes through the health ministry after another leader shall build upon the foundation that was laid. The overall goal is to offer effective health ministry by way of education, being helpful, being present, and offering referrals, etc. And we want to use an evaluation tool to monitor the development and activities of your health ministry. You want to be able to look back over the year to determine the number of people you were able to help, the number of cases or situations you were able to assist in, and how the health ministry have been a blessing not only to your faith community, but to the community at large. Next slide, please. One of the questions that I always get is, what is a job description of a health minister? What is a job description of a health minister? Well, I have a sample one. For example, the health minister will promote the integration of body, mind, and spirit by providing leadership and identifying and responding to the health-related needs of members of the local faith community. The health minister must be vigilant and aware and be cognizant of the needs of the community that she or he serves. They need to have knowledge, skills, experience. And some say 3 to 5 years in a human service related field. We want the health leader or the health minister to do well in bedside manner, to be kind and compassionate, have the ability to understand and communicate the concepts of interrelatedness of the body, mind, and spirit to health, healing, and wellness, and a clear understanding of commitment of the goals, the mission, and the vision of the faith community relative to the health ministry. Of course, the person should have great communication skills. Now, the next slide talks about the job relationship. Perhaps you will report to the parish pastor, the imam, rabbi, or faith community leader. Or perhaps you will report to an executive pastor or another ministry leader who may be over ministries. The health minister may directly supervise volunteers or laity in the health ministry. And the health committee, other professionals in health ministry, faith community staff, and members of the faith community and general public. That's what this health minister is related to. Next slide, please. So some of the responsibility and tasks are, this is not exhaustive, this is some samples. There will be physical demands. There will be manual dexterity and mobility, frequent standing, bending, sitting and walking, occasional lifting, pushing, and pulling. We would like for you to have good eyesight and the ability to see clearly at 20 inches or less. Role support, regular standing meetings. Faith community leaders, next slide please, should have regular meetings with their volunteers or those who work in the health ministry. They need to have huddles, perhaps before a worship opportunity or before service time, to talk about what they have in place in the plan they intend to engage in or practice. It can be recommended that the health minister participate in spiritual direction, theological reflection, or other personal spiritual growth and development exercise on a regular basis. The health minister must too be engaged in the theology and the faith and the traditions of the congregation that she or he serves. Can we look at Congregational Assessment Health Survey? Now we want to talk about what the survey could look like and some of the questions that you can ask. For physical health, perhaps you ask members of your congregation and community on a survey, do they want to learn about first aid, CPR training? Do they want to talk about end-of-life issues? What about weight control, lack of exercise or physical activity? Some are dealing with allergies, exercise, fitness, nutrition, healthy cooking, eating, chronic disease management. These are some of the questions you ask on the survey. Under mental or emotional health, let's ask questions about depression, loneliness, or isolation. stress reduction, stress management, anxiety or worry, sleep disorders. Perhaps someone is seeking need for personal counseling, thoughts of self-harm, physical and or emotional abuse. Some more congregational assessment health survey questions that you can ask, as shown on the next slide, are dealing with interpersonal or caring for others. You want to know if there are persons who are at home that are ill. Is the person filling out the health survey, are they a primary caregiver for another person? And what are the barriers to raising healthy children and relationship problems? These things still deal with mental health, but you ask that question because you want to know what kind of resources people in your congregation may need. Then, of course, there's spiritual health. Some may need for spiritual renewal and focus. Others may have spiritual emptiness and dryness. And some may need help with enhancing or reuniting their prayer or their personal devotional life. Go to the next slide, please. Then there are age and gender specific concerns. For example, men's health, women's health, adolescent health issues, children's health issues, infant health issues, and the aging process. So these are topics of great discussion. And then there's social issues, legal issues, housing problems, advanced directives, financial problems, or underinsured or uninsured persons. These are some topics that need to be discussed and brought to the forefront for not only the faith community, but for the community at large. Then the next slide deals with financial and social issues, advanced directives, living wills. What is that? How is that developed? How is that written? Where can we go and get resources for that? Some people need to understand insurance between whole insurance and term insurance and health insurance. Some may need help with money management, talking about or understanding what hospice is and what palliative care is, and needing help with insurance or navigation. Interpersonal, dealing with communication skills, caregiving, marriage enrichment, parenting, or those who are single parents. Those are some of the things that you ask on your congregational assessment health survey, to ask the members of the congregation, what are some of the needs that we can address? How can we meet your needs? And what are some topics that will be helpful? On the next slide, you'll see there's a bibliography of where I received information or did my research. And then we want to talk about some resources that I think are very helpful. The next two slides, some resources. If you go back one slide, please. No, I'm sorry, the slide on resources, my apologies. Dealing with Mental Health Ministries. That's a great website that gives some ideas on how to engage or jumpstart a mental health ministry. Then there's Mental Health First Aid, the National Institute of Mental Health, National Alliance for Mental Health, Metro Baltimore, World Health Organization, and this is a nice organization called Pathways to Promise. Pathways to Promise. Again, I thank you for your attention and for being here today as we discuss mental health matters, building effective health ministries. My name is Pastor Dominic Smith, and this has been a pleasure to be with you this afternoon. Thank you.
Okay, I tried to stop it. I tried to stop it in enough time because I didn't edit the video. I'm not an editor, but hopefully that presentation was helpful to you. Again, if you joined us late, that was, as you can guess, a recorded presentation from Reverend Smith, who unfortunately experienced a loss in his family and could not be here today, but still did want to present the information and be helpful to colleagues, to his colleagues. And so we were able to pre-record that session. So at this time, I know that Nova and Jamie have been very diligent about checking in the chat just to make sure that we were answering questions. But I do also want you to put any specific questions that you have for Reverend Smith related to the information that he shared. And I'm so thankful for how thorough he was. If you have any questions related to specifically what he shared, please put those in the Q&A, and we will make sure that we will get those very specific questions to Reverend Smith. One of my colleagues, Jamie or Nova, will also put in the chat Reverend Smith's email, his direct email, where you can reach out to him directly about any questions you have about this or extended questions about anything that he shared. I do want to say that one of the reasons why in the proposals that we received, we chose this one was because over the years, we've been doing this for 6 years. And over the years, one of the things that I've specifically heard as I'm going around and talking to different congregations and different faith leaders is, you know, my congregation is but so big and we do this and we do that. And sometimes we just don't know where to start. We know that there is a need because, again, all faith leaders have a unique perspective in that folks come specifically sometimes to the head of their congregation, be it a synagogue, be it a mosque. Sometimes you'll go to the head leaders to share very personal information because you feel safe. But sometimes in turn, those leaders don't often know the right way to turn. And so one of the reasons why this presentation stood out for us so much is because it was one of the presentations that actually included steps on how to build whatever it is that you want to build. Now, we call it a mental health team. You may call it something else. Reverend Smith calls it a mental health ministry. Whatever you call it, the goal is to support your congregants who are living with a mental health condition. And so I'm checking my chat just to make sure. Oh, and there's things in the Q&A, so I'll make sure that we're looking at that, but I do want to just finish my spiel. If you did not join last session, what we are thinking of when we're looking at the series is that we're building one webinar to the next, right? So at the end of this month, the end of this series, there will be a 4-part, really good kind of step 1, step 2, step 3 in terms of why this is important, what to do next, how you can use the resources at your fingertips to be effective in the way that makes sense for your congregation. And then kind of wrapping it all together and talking about in the final webinar in the series, we'll talk about how you fit in the ecosystem of care and why you should make sure that you solidify your place in it. And so what I really want you to do is I do want you to stay tuned, stick around, invite other people to this series so that they can learn what makes sense for them. I will go to the Q&A because I want to make sure. Oh, this is a really good question, the timeline. So Reverend Smith will have really great, he'll probably give you a different answer than that. And I imagine if you engage with any other faith leader that in your circle or someone else's who has a mental health ministry, you're probably, or excuse me, a mental health team, you're probably going to hear a number of different timelines. But what I would say from the vantage point where we sit, it really depends on the resources you have at your fingertips. And it also depends on how expansive you want your leadership team to be, or like how much you want your leadership team to do. You could do it in increments. You could say, well, initially, I just really want to have good resources. I want to give my front office folks really great resources. And to that, I say, well, we can help you with that. We have a toolkit that we've developed. It's called the Faith Leader Toolkit. And we've spent a lot of time, even during the pandemic, curating the list so that all of the resources that we have at our fingertip, when a person calls our helpline, that all the resources are good, meaning they're up to date, they're good right now. They weren't good in 2019, they're good in 2021. And so we can share our faith toolkit with you, and you can give that to your front office personnel to be able to handle that, or your go-to leaders in your congregation who are in charge of handling or supporting your congregants' wellness, right? So that's like step one. Step two could be like, if you're trying to build out your team, then it really does depend on how expansive you really want to be. So especially following along with the resources, or at least the tools and some of the things that Reverend Smith wanted you to think about. So yeah, it really depends on what you want to do and how extensive, that's what I meant to say, extensive you want to build out your team so that they can be helpful. An assessment is probably involved. Surely what Reverend Smith, I keep calling Reverend Smith had shared, you do want to do an assessment. So the timeline is up to you. I said all of that to say the timeline is really up to you and what you want to do. I think the first thing that would make you helpful, will make you helpful right off the bat, is getting your hands on really good resources. And again, we have our faith toolkit that we can just sail right to you. I can email that thing to you, or at the end of this, my plan is to send out hard copies to those who would want them. So we can talk about that. You are more than welcome to reach out to me. And if one of my colleagues can put my email in the chat, I'd appreciate that too. But I will be also following up. I'm also trying to be mindful. Oh, the PowerPoint. So thank you. First off, thank you to Jamie and Nova, who are sending me text messages so that I can be helpful, because sometimes I can't multitask very well, so I appreciate them. This PowerPoint and the PowerPoint for last session, all of the PowerPoints in this series I will make available to you at request. So again, this webinar was recorded, last session's webinar was recorded. Every single webinar in this series will be recorded and made available to everyone. We'll put it on our public website. We'll probably at some point put it on YouTube as well. So everyone who registered and or attended, you'll get a little note telling you where to go to find to our webinars. But as it relates to the presentation itself, I can make that available to you also upon request. Just shoot me an email and we'll go from there. Again, though, specific to what Reverend Smith was sharing, we have good information, but one of the reasons why we chose this year specifically, we wanted faith leaders to talk to you because they're in the trenches and they're living it at the moment, right? So you heard from, everyone in the series is a faith leader, this is an interfaith presentation board. So next week we'll hear from Rabbi Elisa Sachs-Cohen from the Baltimore Hebrew Congregation and her team, sharing very specific information as it relates to how you can use resources you already have access to, worship practices that you already use in your congregations, how you can use that as a means to help advance the conversation about mental health and engage congregants in a more meaningful way. So I will encourage you, at all costs, I will encourage you to reach out directly to our presenters, because again, they're subject matter experts who are living in it, but at the same time, we're good sources of information as well. So Reverend Smith's email is in the chat. So please make sure you're reaching out to them. And I'm also checking just to make sure. Okay, so there's a long question in the chat, and it reads, what resources for healthcare workers and mental health faith-based support services? Okay. So that is a really great question. So the short answer is NAMI National, NAMI.org, and one of my colleagues have put it in the chat. If you go to NAMI.org, there's a whole host of really great information that folks in the mental health field who aren't necessarily in the faith field as well can benefit from, just very basic general information. That would benefit you, and you can add that to your resource library to be just a little bit more helpful. As it relates to something more specific to our area, that's a little harder. And sometimes you kind of need to create what you're looking for. And so one of the things that we as NAMI Metro, we spend a whole lot of time doing is building partnership in the community so that we can do two things. Build our resource list so that we can stand in the gap in the way that we do, which is provide great mental health education and support, and then advocacy. That's where we lay. And outside of those three very specific and very necessary tools and resources, we refer out to other organizations who are a little bit more helpful. And sometimes we have the ability to work with mental health care professionals to stand in the non-clinical way that we can, because we do not provide clinical support, but we can provide really good peer-based information, and again, classes and support groups by way of helping. But as it relates to mental health professionals, sometimes your best answer is kind of, number one, know the landscape a little bit better in terms of who are the non-clinical supports in the community that can help out when a person has been discharged. But then also to be able to support yourselves, and generally speaking, your colleagues. Sometimes you could reach out to organizations just like us. We have a whole host of non-clinical programs that we might be able to support you through. But as it relates to that sweet spot where mental health professionals and faith leaders live, sometimes you guys need to connect with each other to find the best way to fit. What we know is that lots of congregations, and I hope I'm answering this question correctly. If not, I apologize. I'm doing the best that I can. But there's Reverend Smith has really great information, and there are other folks, I'm sure, who have really great information. But from our vantage point, the sweet spot where faith leaders and mental health professionals can really benefit from each other is first coming into the room and talking with each other and understanding the best way that you can support each other. Mental health professionals are always trying to do their very best to provide great resources in the community, and faith leaders want to support their congregants as best as possible. Sometimes what that looks like is you have a mental health clinician who's spending time either on staff or who are just purposed to spend some time like a partnership with a local clinic that you can give referrals out and you guys can work together. Sometimes it looks a little different than that. But I know that one of the purposes of this conference, certainly why we do this, is to plant the seeds so that you can be the very best help that you can be to your congregants, and I'm talking to the faith leaders. So you can be the very best helps that you can be to the congregants, and then switching over to talk to mental health professionals, that you can reach folks everywhere that you can possibly reach them. And sometimes we could all do a better job, and I'm looking at us too, NAMI Metro. Sometimes we could do a better job reaching congregations where they are to be able to provide good resources, because sometimes sometimes we miss folks who are in congregations simply because we don't go there. Physically, we're not present. And that is a way that we could be present, is literally faith organizations inviting us into their communities. And certainly what we know is that several congregations, several mosques, several churches, and several synagogues have faith leaders who are welcomed as part of their team, of their staff, who do a really good job of providing that mental health support within the congregation. And so if you're not able to do that, at the very least, you can partner with your local clinics to be able to create some sort of pipeline, some sort of support system. And I hope I was able to answer that question decently enough. And I'm checking, there are a lot of comments in the chat, and I'm looking for my colleagues to see if there are any other questions. It is 11:56. I know that there are probably 1,000,001 other questions, but I appreciate you though for spending time with us. Again, I'm very appreciative of Reverend Smith for taking the time out to provide this presentation, even while he was grieving. I just appreciate that sacrifice, and again, to share his contact information so that he could be available to answer your very specific questions. I appreciate that. And what I will do at this moment is I'm going to share my screen one last time, and I'm going to share, if I'm able to, I want to share a little bit of information, and I'm going to go pretty quickly if I can. Sorry, this is essentially the presentation you just received. Okay, hold on. I did not set this up appropriately. Okay, bam. This is what I really wanted you to see. So again, this is us. Many of you are already connected with us, and I appreciate you for that. And by us, I mean NAMI Metropolitan Baltimore. But if not, our website, namibaltimore.org. We have one more webinar that we are, you're gonna hopefully you will come back and join us for. But if you want to learn about the other things that we're doing for Mental Health Awareness Month, definitely go to our website, namibaltimore.org, to find out more about that and the myriad other programs that we do. If you have specific questions about what we're doing or the work that we do or how we can work together, your organization, your faith organization can work with NAMI Metro, feel free to call our office. We're not in our office right now, but we're definitely always checking our helpline and answering our helpline. You can email us though at info@namibaltimore.org, and you can also call us 925 Monday through Friday, 410-435-2600. But next week for our third webinar in the series, please join us for a webinar entitled Supporting Internal Family Systems Mental Health Model with Spiritual Practices. And that presentation is led by Claudia Cameron and Rabbi Elisa Sachs-Cohen, and also Becky Mann, who's the cantoral intern. And this presentation team is from the Baltimore Hebrew Congregation, as I mentioned before. And now for a moment, if you will just indulge me for one more moment, I meant to say very quickly that I do have a survey that I would appreciate if you would just stand by and share, or at least fill out. So in one moment, I'm going to launch it. If you please, if you could just fill out this poll, I would appreciate it. That will help us understand what you felt about this presentation and give us some feedback for future ones. So I just launched the poll. It should have popped up on your device just now. So if you can just fill that out as soon as when you're able to. I'll leave it open for about a minute. So if you can begin to fill that poll out, thank you so much. I'm seeing that folks are beginning to fill it out. Thank you, thank you, thank you for filling this out. Actually, I'll leave it open for longer than a minute. We're now on a clock here. But I do want to be mindful of your time. We are approaching the hour. So thank you again in advance for filling this out. Thank you so much for filling out the survey. And thank you for spending your hour right before lunch with NAMI Metropolitan Baltimore.